of vascular and endovascular surgery. I'm delighted for the honor of presenting in such an elegant conference. As you have just mentioned, sir, my talk is about the diabetic food salvageability, however, the limited resources there is. Among the agenda, we have to discuss the prevention through education and community engagement, early detection and risk stratification, cost-effective food management, glycemic control, strengthening healthcare systems, amputation prevention, emerging technologies and innovation, policies and advocacies. For the first point, I have to mention that we have to depend upon plenty of resources and co-persons. For example, we have to depend on community health workers, low-cost and culturally sensitive education. And of course, in our developing communities, we have to highlight the importance of daily food hygiene to our patients. Washing with soap, water, drying fluid and moisturizing. And this should be done through scalable methods like radio posters and group sessions. Believe me, it's important to highlight the issue of the importance of the prevention and care, and to let patients as the first element of the triangle to be very well acknowledge and know the fact of their preventions and the fact of their disease, because they don't know about the disease so much. So we have to develop this message through these working groups. And footwear promotions. Sometimes we see all that in our clinics that they don't care very well for the footwear. So affordable footwear is a must. And patient empowerment through software, and this will be easily elaborated and clearly by Professor Dr. Nabil Hanna. This is from our experience. We have to educate patients, we have to teach them, we have to show them, and they have to know what is their disease and what are the risk factors they have. We have to post on our pages all about the knowledge, all about the nutrition, all about the risk factors, and all about what they should know and what they should do. Also, we have to post broadcasting like this podcast in our institute with all our professors of our domain of diabetes and endocrinology. The fact is we have to teach them what to care about, what to know, what is the serious problems they have, and post this on our pages. Also, a lot of patients need a lot of instructions. The second corner of the triangle is to teach the doctors, and this is of supreme importance, what I'm going to intervene. The Egyptian Vascular and Endovascular Society, as seen by the chairpersons in this picture, we carry the education workshops to teach doctors, juniors, and all in the, coming into the field how to early and efficiently and non-costly interventions. Also, we do this in our institute as workshops. And the third anchor of the triangle are the nurses. We have to teach nurses clearly and well with all the facilities we have. You can see the tree there, the lesions there, and we have to invest in this very much. We have invested in our institute in a complete institute for nurses. 5 years, we get these nurses, we acknowledge these nurses being a cornerstone. They are the first to see the patient, and we can use them and utilize them to go all through and see a lot of patients and extrapolate the patients who need the specialists to review them. If we have the whole wheel together, we can achieve from early diagnosis, pre-operative assessments, duplex assessments, echo assessments, and last but not least, I have to highlight the fact and the importance of early and efficient surgical procedures under local anesthesias. These are efficient and cheap. What about early detection and risk stratification? This is done, as we all know, it's the issue of peripheral neuropathy and vascular infection. Affordable tools to detect peripheral neuropathy are the tuning fork and the monofilament. Please don't forget this as an efficient, low-priced tool, as well as the ankle brachial index is still mandatory to be measured and to assess the neuropathy, peripheral arterial disease, and the prior ulcers or the ulcers that will develop to be very well cared about. You can use the technology, you can use the mobile phones to detect and collaborate between these items to detect the risk factors early and efficiently. What about the wound management? Total contact costs are still affordable, and offloadings by fat pad or fight fountains are affordable and can do the job. Importance of affordable dressings is of paramount importance. Using saline, affordable dressings, this will diminish the cost and do the job. Also, affordable antibiotics are a must. Start escalating from a low-priced antibiotic like amoxicillin, lhab, in mild infections, and help this with your scalpel to debulk and diminish and to diminish the effect of the infection. And beware, and I have to highlight this very clearly and boldly, the multi-resistance organism development. This is done by a local antibiotic stewardship. We should all have it in our institutes and in our practice. And of course, the gram-stained smears are important. Antibiotic therapies should be fashioned as per the International Working Group of Diabetic Food Guidelines as well as ITSA guidelines. This would help the cost and ameliorate the effect. Glycemic control. In the American Diabetes Association, they mentioned that a hemoglobin A1C of 7 for diabetics is to diminish the risk. But if you have the risk after diabetic food, we have to maintain it at 8. And we can use low-cost generics like metformin and insulin. And we can support this by the government, as our government do here in Egypt, and through non-GOs partnerships. We have to highlight the importance of reducing refined sugars, and this is one of the initiatives of our Ministry of Health this year to highlight clearly the importance of diminishing refined sugars, and we have up to escalated taxing these to prevent excessive unneeded utilization that would demolish the control of diabetes and thus ameliorate the infections with diabetic food. Physical activity is also important and it costs nothing. Community-based programs reducing the diabetic food ulcers risk through lifestyle education is an important factor, and help the patients to recognize the symptoms of hyper and hypoglycemia to ameliorate your effect and ameliorate the control of the diabetes and thus the infection rates. Strengthening healthcare systems through, as I have mentioned, community health workers and nurses, and reserve your specialists, reserve your reservoir to utilize in serious cases. NGOs are important to secure consistent supplies like non-filament dressings and antibiotics, and to produce local offloadings and foodwares of reasonable prices. And please don't neglect and ameliorate and augment and focus on the role of a pediatrist. Amputation prevention is a must. This is an important factor to prevent excessive loss of finances. It's with clear pathways through vascular assessment and surgeries at the end of the pathway to diminish the amputation, and this is done only by early, knowledgeable reference. Prioritize the limb-sparing procedures by debridement and local anesthesia and ankle block will diminish your expenses and solve the problem of highly expensive procedures, and then you can do this with reasonable pricing. Early interventions to reduce lower limb amputations have been mentioned in the American Heart Association as a mandatory to all those who are affected by peripheral vascular or diabetic foot diseases. After amputation is inevitable, please care about rehabilitation. Affordable crutches and locally made prostheses are of paramount importance. Emerging technology and innovation will be very well elaborated by Professor Dr. Nabil Hanna, but in a glance, please, if you are going to apply up to an artificial intelligence, don't leave traditional medicine there. It should be completely elevated and ruled out. If you are going to speak up to artificial intelligence, don't have it hand in hand with old remedies and old traditional medicines. And of course, we can very well use high counter stresses elevation through low-cost insoles designs inside our footwear. The policies and advocacies. Diabetic food care should be integrated in all national health policies, and this is made here in Egypt through the initiatives of His Excellency President Abdel Fattah al-Sisi, who have just elaborated on the health of the Egyptian person that should be encompassed all their affections, diabetic feet, flu, diabetes, and non-communicable diseases. Also collaborated with NGOs. We have collaborated with the Rotary of Egypt through having an EMG and an Activa devices to diminish and elevate the pressure through elevating and treating be a peripheral neuropathy. And moreover, we will contribute all NGOs to have our patients in safe hands and in very well expanded upon. Registries are of paramount importance to know where we stand, and this is done through the initiatives of the President as well. Challenges are limited resources, and MRI and cultures are expensive, and middle-income countries all have to implement guidelines, but we still have the X-rays, we still have other modalities rather than the expensive one. And the culture barriers, please, we have to address beliefs in the traditional remedies that really care through community dialogue. And by these remedies, I mean how to care about the field, not how to do what we call bathroom surgeries. The key of recent insights from 2025 are based upon high-risk individuals like males with low BMI, prolonged diabetes, and smokers. For these risk factors, the Chinese have conducted a study for the BMI and the combination of neuropathy, fungal infection, and poor glycemic control as the key predictors that should be very well highlighted and cared about. And please, of its paramount importance, to resist as much as you can the MDRs, the multiple resistant drug organisms. Don't utilize and abuse your antibiotics, the precious ones, to the extent that we develop MDROs. It's of paramount importance to carefully, and not only for the sake of cost, but escalate your antibiotics as per the cultures to prevent developing MDROs, which could be fatal to the future of combating diabetic foot ulcers. In diabetic foot ulcers, we have 20% incidence of amputation and 50 to 70% 5 years mortality. So please have all tools, reasonable price tools in hand and very well taken care about, as prevention is crucial. In a nutshell, we have to salvage the field through screening and stratification by affordable tools, local workforce empowerment, vascular assessment and referral, and assess to diagnose, guidelines and protocols, education and engagement of all health workers, nurses and doctors all together in a triangle. And thank you very much.